Many people who live in rural Minnesota are being forced to drive upwards of 50 miles or more to get the proper medical treatment.
Much of this is due to the shortage of specialists in rural hospitals and the pressure to keep up with health care trends. Katie Anderson tells us how this trend is impacting patients in Ely.
Hannah Bermel lives in Ely, Minnesota. She's a mother of 3 and just had her 3rd child, Brooke, on Friday.
It's okay, Daddy. Oh.
But instead of being able to go to the hospital in her hometown,
It's right behind our house.
her husband had to drive her 50 miles to Virginia so she could deliver her daughter.
She wanted to come Friday morning, and they were not able to deliver during the weekends.
Ely Blumenson Hospital officials say the elimination of some surgical staff has forced them to phase out planned deliveries by July 1st of this year.
You could kind of see the end of the road coming about 5 years ago when we lost a general surgeon here, and a lot of the services that the surgeon provided were also necessary to support obstetrics.
Fossum says the hospital, like others in Minnesota, is being pressured to conform to cost models of care facilities in metro areas. One example that cost the hospital about $25,000 was the need to be prepared for Ebola.
You have these costs that are affecting rural health care with no real tangible way to assure that you can recover some of that investment, and so it's difficult.
It is also making it difficult to provide the necessary care to the community when the time comes.
It would have been really handy to just be able to walk over there when it was time. We were kind of hoping for it.
In Ely, Katie Anderson for KBJR 6 and Range 11.
The hospital in Ely will still be able to accommodate emergency deliveries as well as prenatal and postnatal care.
All right, turning